Hello, my friends. Today I want to chat a little bit about SPD. It is one of the questions I most commonly get from people is how to manage SPD or pelvic pain in pregnancy and postpartum. So today I'm going to share with you 3 exercises that tend to find their way in my clients who experience SPD in their workout programs. So let me show you. All right, so we're going to talk about a 3-step approach to SPD or pelvic pain. This first exercise is a stretch. I often find that clients are doing a lot of stretches, so make sure you don't miss the mobility and the strength exercise. This first one, you're going to need a bench or a chair. You can also sit on your couch. Sometimes that may lend to a deeper stretch. So you're going to take one foot, cross it over the other in a figure 4, and you may already notice a stretch here in the outside of the glute. And then I want you to take your hand onto your knee and you can gently press down. Now, if you get any pain while you're gently pressing down, just let that up. That is totally fine. But sometimes if we press down just a little bit and then release after a few seconds, you'll get a little more mobility into that joint, a little more stretching there. So you're going to do this for about 30 seconds on each side. And then I want you to note the difference side to side. Do you feel like it's harder to open up on one side? Do you feel a deeper stretch on one side? Muscles are tighter? And just note that second piece to the puzzle, second exercise is mobility. So you're going to need a surface that is raised. You can do a countertop or the back of a chair, whatever works for you. You're going to lean over that ball or the chair or whatever you're using and place your feet about hip width apart to start. Now, we're also strengthening the inner and outer thighs here as you move from one side to the other. I also want you to note where you feel any pain if you do. So it should be a gentle side to side rock, and then you'll start to sway your hips with it as well. So this is opening up the pelvis and also doing some gentle body weight strengthening on the inner and outer thighs. But if you get any intense pain or it doesn't feel great for you, I want you to adjust your stance. Narrower might be the most helpful position for you. And then just rocking those hips side to side. So opening up the pelvis and mobilizing it. That's exercise 2. Last but certainly not least, the strength piece. This is the game changer for many of my clients. We can stretch all day, but keeping the muscles of the core, the hips, the glutes, all of those things strong can be really helpful for managing your pelvic pain. So you're going to need, I would have a ball, but I can't find the ball that my kids have taken and hidden somewhere. So we're going to use this pink stuffed animal or a band. So 2 ways you can do this depending on how you're feeling. Many people note that they have pelvic pain when they're sitting down and standing up. So that's exactly what we're going to practice. We're going to strengthen the muscles that work that. So if you do experience that, I want you to have something to hold on to, something you can leverage. Now, the first thing we're going to try, because it can either be inner or outer thighs, depending on the person, is you're going to put your ball or your stuffed animal, whatever you've got, in between your knees and do a gentle squeeze. So feet flat on the floor, you're going to sit down and maintaining that gentle squeeze, stand up. Now you might want to have something that's a little more robust than this so your knees aren't quite as close together. A ball would put your knees a little further apart, which might be best for you. But working with what we got, you're just sitting down and then standing on up. Now, you'll know pretty quickly if that option isn't going to work for you. So if you do put the ball in between your knees and you squeeze and you feel pain, just move along to this other option with a band. With your band, you're going to place it right outside, right around your knees, and then gently tracking your knees out, sitting to standing. So 2 different options you can try depending on what you feel. Now, not all SPDs are created equal. Some cases may be worse than others. So if you find yourself taking all the suggestions but nothing's working for you, or you're struggling to put the pieces together and gain more movement, I highly encourage you to apply for my one-to-one coaching program. The link is below, and let's chat about how I can help you. And as always, thanks so much for watching. If you enjoyed this video, like, and please comment below if you have any questions. Make sure you subscribe to my channel for more tips and information.